City News everywhere.
With nurses burning out and with hospitalizations increasing again, it's becoming tougher.
Quebec nurses under pressure as the province braces for a massive shortage amid the fourth wave of COVID-19, possibly closing ERs in certain regions. More than 4,000 nurses are missing from the public system.
We have nurses that have to take care of the 250 patients, and we have nurses also who went home because they think it's too tough. And I understand. It's like the chicken and the egg. Because we're missing some nurses, the remaining ones have to work harder. So that's why it becomes urgent to add some nurses in order to improve the working condition.
Nurses often working in environments with forced overtime due to the labor shortage.
When you end up being short-staffed, you end up having a greater patient load. These patients each have a complexity of care that you need to be able to identify and to make sure that you're administering care appropriately. And when you have more patients, that becomes harder to do. It's harder to create a human connection with them because you end up just rushing things.
It's psychologically demanding. It's not only physically, but psychologically demanding. So combine those two, and you have a result of burnout. And that's what people are experiencing.
It puts a huge stress on the whole system, and the population sees this and they start to lose confidence.
All healthcare workers in Quebec are being mandated to get vaccinated 2 doses by October 15th, or they'll be suspended without pay. The Premier says they're looking at incentives to draw nurses to the public system and even get some out of retirement.
There has to be a priority on attracting young people to say, okay, the unions, the government, the ministry is putting into place conditions where there's perspectives to improve the situation. And if that's done, young people, once they come in, they have a passion for the mission of what's being done.
I know we'll make it through, but hopefully the government finds ways to help alleviate the nurses' plight at the moment and help bring new staff in to help us overcome the fourth wave and in general get healthcare back going again.
In Montreal, Alyssia Rubertucci, City News.